Good morning, Dr. Jessica.
Good morning, how are you?
Fine, how are you?
I'm good, thank you.
You are finally coming to the end of your stay in Uganda, and particularly Jinja Hospital, after quite a long time, over 5 months.
Yeah.
Could you please tell us about your experience in Jinja Hospital?
Yes, of course. So I have been mostly working for the special care baby unit, which is at the main hospital of Jinja, although I have had some involvement with the paediatric side over here. So my experience has been very good. I have really enjoyed my time. I've really enjoyed meeting all of the workers that were here, but it has also been very difficult in many ways, particularly for special care, being that I have never seen so much sort of prematurity and so many babies die, and I think that is something that is new for people who are coming into the country. Having said that, there's a lot of work done here that is done by very few members of staff, and all the staff are really trying to learn and educate themselves and improve their own service, but they're dealing with a very difficult set of circumstances. I think it is worth thinking, if you are interested in looking after babies, about doing the simple things, and certainly the main thing we've tried to promote has been keeping babies warm and neonatal resuscitation. And for anyone coming in the future, I think reinforcing that message of keeping babies warm and resuscitating babies well will certainly be something to try and continue in the future and try and improve things. In general, it has been excellent. I can't thank particularly the sister in charge of special care enough for how positive she has been and how well she has received any ideas that I or Colin have had. And I really would recommend it to anyone else who's interested in tropical medicine, interested in medicine in a different country, to come here.
Okay. What are your recommendations to the improvement of pediatric care in Jinja Hospital?
Okay. So I think Colin has already talked about paediatric care for this side, so if I focus on where I have been working, which is for the special care, I think the main improvements would be to try and get more nurses to help with the demand for the service. There's a high number of babies admitted to special care, high number of babies delivered, and I think having more nurses and more trained nurses would be very, very helpful and save many more babies' lives. I think particularly training members of staff in good resuscitation skills and having a rolling programme of checking their skills every few months would mean that many more babies would survive, and heavy promotion of kangaroo care to keep those babies warm is the main way I think things could be improved. I think similarly you will always have problems with equipment, so making sure that basic equipment like cannulas and oxygen are always available, particularly for neonatal care, makes the biggest difference. And my hope in the future would be that there would be an opportunity to have access to phototherapy one day, but I think some other things are higher priority before that. So keeping things simple, keeping access to cannulas and to oxygen and to warmth for babies will save many, many lives, I think.
Thank you. How do you think other volunteers elsewhere desiring to come to the country should prepare to better adapt to the environment and work in this country?
So I think I would just echo what Colin had already said, really, that it is never quite how you imagine it to be. Even it is definitely worth trying to prepare yourself and familiarise yourself with any local protocols or anything that you could get information about before you come, because it will make the transition a little bit easier. But certainly it is so incredibly different to where we have worked previously that do not get disheartened if when you arrive you feel a little bit overwhelmed. I think that is what everybody feels like that comes to such a new environment. And if you persevere, particularly in the context of Jinja Hospital, where people are very, very encouraging and very friendly, you will certainly make some progress, and you will certainly leave here a better doctor than you came, and hopefully will impart some knowledge along the way. So just taking each day at a time and knowing that you will have some really challenging situations, but then next week you will have some positive situations, and that is just how life goes, and particularly in this situation you can't always fix everything, but you should try and prepare and just allow yourself some time to settle in before making any changes.
Thank you very much.
You're
Good
welcome.
luck to your endeavours in the UK.